Plus, it is highly contagious among dogs. What you need to know about the canine influenza virus and how to keep your pets safe. We'll be right back. All right, so last month, Chicago was struck with another round of canine influenza. According to Cook County Animal and Rabies Control, at least 100 sick canines have contracted the dog flu this year alone. Now, this is on top of the 700 dogs infected last year. So the question for us dog owners is, what can we do to keep our beloved family pets safe? Well, joining us this noon with some answers is Dr. David Gonski, founder and medical director at West Loop Vet Care. Thanks for coming in today. I think it's an important topic.
Pleasure, Scott.
All right, let's start off with what we're dealing with, the strain. Is it like when we get sick and we're trying, doctors are trying to guess on a flu vaccine as far as what the strain is going to be, or is it the same as we saw last year here in Chicago?
Now, we're very fortunate. For our dogs, there's only two strains. There's the strain we saw in 2015, H3N2, which was new,
okay.
And then there's the old strain, H3N8. So there's only two strains, and we can vaccinate for both of them.
Okay, let's talk about the canine flu. Why is it so serious, potentially?
Sure. It's so serious because it's so infectious. Many dogs have never been exposed to it before, and so if they do get exposed, their immune system is not prepared to react to it. Also, some dogs who are exposed don't even show the signs and then get other dogs sick.
Okay, now I work in a shelter. I spend 1 day a week there. I can talk for hours about kennel cough, which I know is highly contagious. When we're talking about transmitting canine influenza from one dog to another, can they do that? Is it through sharing toys? What type of contact are we talking about?
Primarily, we see it respiratory, so contact, dog to dog, or coughing. But yes, unfortunately, it can go on the clothes of when you leave the shelter. It can be on your clothes. It can be on toys. Anything the dogs contact, it can be there for a couple days.
Okay, so let's talk about symptoms that might present within our dogs.
Sure. What we want to be looking for in our dogs, primarily it's respiratory signs. We're going to see runny nose.
Okay.
We're going to see a terrible cough. You've seen kennel cough. This cough is worse.
Okay.
Some cough so much that they'll vomit. Dogs will get a fever, and some will stop eating.
Let's talk about a vaccine. Is there one?
Yes, there's a great vaccine for this. Like I mentioned, there's two strains. There's now a vaccine for both strains. So contact your veterinarian, because based upon the lifestyle of the dog, its age and health, this is a great vaccine, very safe.
I want to get to the lifestyle issue in just a second, but when we're talking about a vaccine, is this preventative like we would deal with our own flu shot? Get it in advance to ward off canine influenza? Is that what we're talking about?
Absolutely. We want to get this in advance, so if our dog is exposed, the immune system is prepared to react to the virus. And unlike us, there's only two strains. We can vaccinate for both.
Okay, I'll admit I'm an extreme pet owner. My dogs are like my kids. I am very leery of taking them to a dog park or maybe even board them, fearing that communal situations might spread this. Are you advising people, since there is another outbreak, to kind of be careful about exposing their pets to other pets?
Back in 2015, when it was new, we were recommending that. Right now, we're recommending the vaccine. All those social situations, like you mentioned, boarding, daycare, grooming. We have tons of clients in the West Loop who live in high-rises, and they have common play areas or elevators. Those dogs should be vaccinated for this to prevent an outbreak.
Okay, so if folks are watching and they want to go see you, is there plenty of vaccine in stock so that they can get that vaccine?
Yes, there's vaccine at my clinic, and at their regular clinic, they should consult their veterinarian and absolutely get this vaccine if it's appropriate.
That'll be the last word, Doctor. Thanks so much. Important information. Appreciate it.